Hi, I'm Shafali Christopher, and I'm here today to talk about our research on biomechanical and musculoskeletal differences between postpartum runners and Nulliparous controls. Why our research is significant is because women are returning to running after childbirth. Some are even initiating running for the first time after childbirth. USA Running Trends report of 2020 said that about 47% of women runners were of childbearing age. We are finding several surveys that are also reporting that women are returning to running, and about 35% to 80%, nice long range, are having pain with return to running. But what we don't know is what's happening at baseline in healthy runners. Are there differences that have carried over from pregnancy and childbirth that are affecting these runners compared with runners that may have never had a child? So this research is really looking at differences. So we have baseline measurements in healthy populations to then decide what the differences are in women that have had children versus women that have not. Our understanding of biomechanics, musculoskeletal strength, and flexibility will increase with this research. Even though it's a small pilot population, it gives us a starting point of measurements in a lab study versus surveys that we've been collecting up to this point. Our research found that women had weaker hip abduction and adduction. They had tighter hamstrings, and they had greater braking force, which is when they landed, the anterior posterior forces were larger than women that had not had babies. So what this tells us is all this while we've been thinking that postpartum women may have more laxity because of relaxin, getting ready for the birth of the baby. However, one of the things the hamstring is doing is it's getting tighter. And this may be to combat or to counteract or to compensate for the increased laxity in the lumbopelvic area. Some muscles got to work a little bit harder, and maybe that is what's leading to this hamstring tightness. We did assume, because of the lumbopelvic complex in postpartum women, that they would have decreased hip strength, both in abduction and adduction. We did not find any difference with the rotators, internal or external. And from a biomechanics forces standpoint, we did see that they were landing harder, and this also might be a way to increase stability as they're returning to running. So these are some new concepts, and challenges our brain in a way that we would think more laxity, not as much tightness, but definitely gives us a place to start looking with our postpartum runners, anyone who wants to initiate or return to running, at some factors that may be present that we may have normally thought of before. So the clinical relevance of our study, even though it's a small pilot, is a starting spot. We are looking at women that have had babies and women that have not. And what we found is that they did have some differences. What this tells us clinically is that we may have to screen our postpartum runners and give them a physical therapy visit if they're going back to a running or even sport for that matter, because their bodies may have some differences compared to Nulliparous controls. One of the barriers that might affect clinical practice is that not every clinician is taught how to evaluate running gait and what to do once they find impairments. So our recommendation is for clinicians that are working with postpartum runners, especially those that are actively helping them return to running, to seek out continuing education courses and learn more about running gait evaluation and treatment to successfully help this clientele return to running.